think I'm just going to set out like quite a big room.
Okay, so here's a, this is almost, this is about human size, right? Pretty close, yeah? So we're looking at the heart. This is the anterior part of the heart. The reason I know it's the anterior part of the heart is because here is the pulmonary trunk. Okay, that's that big artery that's coming out of the right ventricle over here. If we wanted to get real specific, we could talk about, okay, here's that anterior interventricular sulcus. And so here is where the left coronary artery, which would start kind of up here, would branch out, and here's the anterior interventricular artery. The circumflex would go back this way, and then if we wanted to, we could talk about the great cardiac vein, which would be all right around in this area. Now there's so much fat, I'm not going to take a razor blade and shave the fat off. So we're just going to say that those vessels are right here in this area. Okay. This is the left auricle. Okay, so you can see the left auricle. It's that appendage that hangs off. It is a pocket. Okay, so there is some space in there. But that's the left auricle. And then here is the right auricle hanging off. Okay. Now the aorta is going to be nice and thick vessel. It's kind of behind the pulmonary trunk. And that's what's all up in this kind of fat and mass and connective tissue that's up in this way. Right, so let me zoom out. I'll go ahead and break the heart open like this. Okay, so good dissection here. Okay. So looking at this posterior piece, notice that the thickest heart wall, the myocardium, that makes this chamber over here. This is the left ventricle. So there's where the interventricular septum would be, and then here's the right ventricle. Okay. Now, if we get really, really close, if we want to look at the valve structure, let me focus it up a little bit. Let's see if we, we did have to cut because of dissection. This is the flaps of the mitral valve, and so then these are all the chordae tendineae that you see. So all the chordae tendineae connected to the papillary muscles down in here. If we spread this out a little bit more, we can see the trabecular carneae. Okay, trabecular carneae down in here. That kind of texture on the ventricles that all the models are trying to show you. Now, because this is the left ventricle, if we move a little bit superior, there's additional flaps right here. So those are the flaps of the aortic valve. And so then here is the first part of the ascending aorta. Now this big hole here, that's the pulmonary trunk that's been cut. Okay, that's the pulmonary trunk that's been cut. Coming from the right ventricle over here. Now if we open up the right ventricle, oops, sorry, I want it meant to back out. Open up the right ventricle, we can see way in the back. I'll try to spread it out for you.
So you're going to have this laying out during the ventricle?
Uh-huh. So if we spread this out, there's the chordae tendineae of the tricuspid valve. Let me put the probe underneath it. There we go. So that's the chordae tendineae of the tricuspid valve, and then there's the flap of the tricuspid valve back here. Okay. So that's the ventricles. The atria, remember the atria are above, so if this is the left ventricle, then this space up here that I'm sticking my finger into, that's the left atrium. I can do the same thing with this side of the heart. So that space up there that I'm sticking my finger into, that's the right atrium. Now what I really like about this cut is we always ask, what's an auricle? Well look, this is the space of the right atrium here. But then there's additional space up in the auricle. See? Auricle just kind of hangs off there. Right? So I can get additional space by putting blood inside that auricle. Now everybody always wants to know kind of where the aorta is, so if I pull this back, notice that the aorta is in tons and tons of fat. But see my little probe up there? My little probe sticking out the top. See, it's in the aorta. Okay. Now that's probably the, let me see if I can get the 3 vessels. Yeah, there we go. So that's the brachiocephalic artery. And what I'm doing is I'm looking up into that aorta. I'm just sticking my probe in there. This one is the left common carotid. It's right next to it. Let me get the third one. Come here, you. Being difficult. There we go. And there's the left subclavian. Now what I'm doing is I'm looking from the inside. See, if I look in the inside of the aorta, see the holes? And I'm just sticking the probe with those holes. That's how I'm finding the vessels. Okay. The only other kind of vessel or valve we could talk about is what if I stick this probe in the right ventricle and I come out the pulmonary trunk. I can do that. There we go. Now this one might be hard to do. See where I'm in? See right there? I flip this over. Can you see it?
Yeah.
Shining in there? Yeah.
It's so shiny.
So notice that where that probe is, it's right in here. See, it's coming. So that shows you the connection from the right ventricle to the pulmonary trunk. Right. So, as far as the heart goes, it's not really much. I mean, there's so much fat here, and I'm not going to shave it down. So, as far as the structure goes, that's pretty much it from what I expect from the pickled heart. Okay?